I'll start with the good news first. I can confirm that there are no new cases of COVID-19 in the community today. Wastewater results continue to show no detection of COVID-19 at any of the sites around Wellington, the Hutt Valley or Porirua. Also, a further 7,250 tests were processed yesterday, all with negative test results. It's also the case that over 90% of the identified close contacts of the positive case that returned to Sydney with his wife last Monday have now been returned, and all of those are negative. Cabinet met just a short time ago to consider these results and the broader public health advice around the Wellington region. We've been at alert level 2 in Wellington for the past week out of an abundance of caution. Given the large number of highly populated places that the case visited while they were potentially infected with the COVID-19 Delta variant, we did think that that was a prudent course of action. Alert Level 2 measures ensure that if there are any new cases in the Wellington region, the risk of transmission of those cases will have been minimised through two important tools: limits on gatherings and the requirements around social distancing that are put in place at Alert Level 2. Given that there have been no new cases of COVID-19 detected, nearly 2,500 negative test results from close contacts of the case, including repeat negative results from the case's closest contacts, the Cabinet has agreed to shift the Wellington region back to Alert Level 1 from 11:59 p.m. tonight. Testing centres will remain open in Wellington Central, Porirua, Kapiti Coast, Hutt Valley and the Wairarapa. If you haven't checked a location of interest yet and you are in the region, please do that and go and get a test if you have been to any of them within the specified period. If you have any symptoms of a cold or a flu, any aches and pains at all, please stay home, call Healthline or your GP and arrange to get a COVID-19 test. The more tests that we do and the more results that we receive, the more certain we will be that there is no COVID-19 here in the Wellington region. Cabinet is confident that if there was, we'd be expected to see evidence of that by now, but we still need to remain vigilant. We need to remain at a higher state of alert, although not Alert Level 2, until the full 14 days has passed since our Sydney case left our shores. This is a tricky virus, and new strains like the Delta variant emerging mean that we can never be too careful. It's also important to remember, if we think back to November, when we dealt with a small cluster of cases in November, officials and the case investigators struggled to identify the link between two of those cases. The closest they got was that the two people were in the same street at approximately the same time. Therefore, that just reinforces the need for all Wellingtonians to stay vigilant, to stay sharp, and to come forward or contact Healthline to arrange to get a test if they do start to show any symptoms at all. Cabinet also agreed today that from 11:59 p.m. on Sunday the 4th of July, New Zealand will lift, they made the decision in principle, Cabinet made the decision in principle, that New Zealand will lift the travel pause to allow travellers from South Australia, ACT, Tasmania and Victoria to travel to New Zealand. The health advice is that the spread of COVID-19 in these parts of Australia has been contained at this point. There's robust surveillance, testing and contact tracing to detect and manage cases, and adequate border controls are in place to prevent the spread of new cases. We'll keep a close eye on all of this over the next few days, but the decision in principle allows people to start to plan. We will extend requirements for those coming into New Zealand from Australia during the foreseeable future to get a pre-departure test within 72 hours of when they are leaving Australia. And of course, that test will need to show a negative test result. To be eligible to fly, travellers also must not have been in New South Wales on or after 11:59 p.m. on the 22nd of June, or in Queensland, the Northern Territory or Western Australia on or after 10:30 p.m. on the 26th of June 2021. Those times align with when our pauses came into effect with those Australian states. We want to ensure that New Zealanders aren't unnecessarily barred from travelling back to New Zealand where there is no risk or very low risk of COVID-19, but we will, as I said, be monitoring the situation very closely. As we said on Saturday when we announced the pause, we needed a few days to get a better understanding of the developing situation and the growing number of cases being reported across Australia, and we do have further information on that. Detailed risk assessments have been completed for each state and territory based on the information we've been able to get from those. New South Wales is currently regarded as the highest risk state in Australia. Queensland, Western Australia and Northern Territory have a higher than normal risk, which is why the travel pause there is continuing, while South Australia, ACT, Tasmania and Victoria are considered to have low levels of risk consistent with our green zone travel arrangements. Cabinet carefully weighed up the evidence this morning, and we consider that partially lifting the pause at this point is an appropriate course of action, particularly when bolstered with the introduction of a mandatory pre-departure test. We'll review the remaining pause in place for those other states on Tuesday the 6th of July. There will be a first discussion of that at Cabinet again on Monday. Today's decision gives airlines, passengers and all of those affected the time to prepare flights from those green zone areas when the pause lifts on Sunday night. We know how important the travel bubble is, in particular for families and for businesses, but we also want to avoid a situation where we're having to respond to a case or cases here in New Zealand. Our system from here of opening up to the states where they are able to contain COVID-19 will help to ensure that New Zealand can remain at alert level 1. So I'll now hand over to the Director General, Dr. Bloomfield, for a further detail, and then we'll open up for questions.
Thank you, Minister. Kia ora koutou katoa. So, as the Minister said, no COVID-19 cases in the community, and we have 4 new cases to report in recent returnees in our managed isolation facilities. So in Wellington, today marks the eighth day since the person who tested positive in Sydney departed, and they were out and about in Wellington in the weekend prior to their departure. And it's nearly a week since Wellington moved to Alert Level 2. The increasing number of cases that we see in many parts of the world, including obviously in Australia, is a stark reminder that the COVID-19 pandemic continues and is continually evolving with the emergence of new strains. It does reinforce we are taking the right approach here in New Zealand with our precautionary actions to ensure COVID-19 stays out of our community. In the past week, since Wellington entered Alert Level 2, health officials have had time to gather further information, undertake large-scale testing and contact tracing to establish if there is any community transmission. And just to put that in context, 2,609 people classified as either close or casual plus contacts on one case is way more than we have ever done before, including most recently in the outbreak in Auckland in February, where we cast the net fairly wide. I want to thank all the testers who have done the testing, the lab staff and our contact tracing staff right around the country and our public health units who have participated and contributed to this, and especially those people, those over 2,600 people who have done what was asked of them, being tested and isolated. And a reminder that even as Wellington moves back to Alert Level 1, over 950 people will be remaining in isolation for that full 14-day period. And I want to thank all of them. It's an important part of our response. It's disruptive and it's inconvenient, but it really is a fantastic effort and will help give us confidence that we have headed off any wider spread here. Yesterday, of the 7,240 tests processed throughout the country, over 2,000 of those were in the Greater Wellington region. And since Wellington entered Alert Level 2, there's been more than 8,200 tests in the capital, so approaching 2% of our population, which is what we try to do when we are trying to chase down any community transmission. As the Minister said, wastewater samples taken daily, and we're processing those quickly. I want to thank our colleagues at ESR. They're turning those around within around 24 hours, have shown no detection of the virus, which is also reassuring. I know people will be looking forward across the Greater Wellington region to returning to Alert Level 1. with fewer restrictions. But please do keep up the good habits that we have adopted over this last week or so. In particular, do stay home if unwell. We have got used to alert level Zoom. Keep using it. If you're unwell, get a test and remain isolated until you've had that test back. Let's keep the scanning numbers up, not just in Wellington, but right across the country. And of course, good hygiene and use of masks, which, a reminder, are mandatory, even under Alert Level 1 in public transport and, of course, on domestic flights. So, while the job is not done, there's no denying this is a milestone and that we've achieved that thanks to the combined efforts of many people. A simple thank you then to everyone who lives in the Greater Wellington region and indeed across the country, because some of those people who remain isolated are not in the Wellington region. Just a quick update on Australia. We continue to be in regular contact and participating in the daily meetings with our counterparts in Australia and closely monitoring the situation there. As the Minister said, there are multiple outbreaks across a number of states, but in several jurisdictions, in particular ACT, South Australia and Tasmania, there are no cases. Victoria is still managing some cases from their outbreak, but the recent cases they have identified had been isolating during their infectious period. Please to everybody who has recently travelled back from Australia prior to the pause being in place, the number of locations of interest continues to grow. Please do keep an eye on that, and there is a Section 70 notice in place that requires anybody who was at one of those locations of interest to follow instructions which include isolating and being tested